Neonatal Care Part 8, we're going to discuss some common birth injuries. Birth trauma comes from injuries resulting from mechanical forces during the delivery process. Newborn injuries can occur because of their size or their position during labor and delivery, and conditions associated with a difficult birth include prima gravida, prolonged labor, cephalopelvic disproportion, prolonged or rapid labor, abnormal presentation, large size, shoulder dystocia, prematurity, or low birth weight. Birth trauma injuries include those that involve instruments used during delivery, and they may cause abrasions, lacerations, bruises, or subcutaneous fat necrosis. Excessive molding of the head and overriding parietal bones may occur. You may have a condition called caput succedaneum, which is swelling of the soft tissue of the scalp from pressing against a dilating cervix. This usually disappears in a day or two after birth. Or a cephalohematoma. This is going to be an area of bleeding between the parietal bone and the covering periosteum. This often appears several hours after birth as a raised lump on the head, and it may take 2 weeks to 3 months to resolve. Or linear skull fractures. And with linear skull fractures, you should avoid pressure to involved areas, and displaced fractures will need neurologic evaluation. Brachial plexus injuries. These typically occur in deliveries complicated by shoulder dystocia. And with brachial plexus injuries, you may have Erb palsy, which is common, or Klumpke paralysis, which is rare. You may see facial nerve palsy. And with facial nerve palsy, findings include asymmetric faces when crying. Full resolution of cranial nerves may take several weeks with this. Diaphragmatic paralysis, and they may experience respiratory distress, hypercapnia, acidosis. Laryngeal nerve injury, and this may present with stridor or hoarse cry, and paralysis often resolves in 4 to 6 weeks. Or spinal cord injury from excessive traction with a breech delivery, or rotation and torsion from a vertex delivery. The clavicle is the most frequently fractured bone in the newborn. Most often an unpredictable and unavoidable complication. Risk factors include large size, mid-forceps delivery, or shoulder dystocia. May present with pseudo-paralysis to help prevent pain. Crepitus, palpable bony irregularities, and possible lack of arm movement on the affected side may show in an examination. Long bone fracture may present as loss of spontaneous arm or leg movement. And intra-abdominal injury is uncommon in newborns. Consider in every newborn presenting with shock or unexplained pallor or abdominal distension intra-abdominal injury. Hypoxia and shock could be caused by birth trauma.